Welcome to session 3, the third and final session of the 7A communication project. Today we're going to be talking specifically about some communication tools that can be used for effective communication. Just a quick recap of sessions 1 and 2. Session 1, we talked about the data, the current state, you may say, regarding nurses and physicians' perceptions of communication, and we identified that there were some areas for improvement related to accuracy and openness of communication. Miscommunication continues to exist. We talked a little bit about that. The Joint Commission, in their Sentinel events that were reported to them, found that communication or miscommunication was the root cause of 82% of those Sentinel events. The second session, we talked about leadership and followership. We talked about how each and every one of you are leaders, and that what leaders pay attention to, what they measure, that really shapes the culture and the work environment. So if communication is important to you as a leader, accuracy of communication, openness of communication, then that will also be what's important in that work environment. Effective followers, we talked about what it means to be an effective follower, and that it's more than just agreeing with a order and just doing it. It's really about two things. It's about inquiry and advocacy. Inquiry results when, as a nurse, you may or may not agree or understand why a particular order is given. So the nurse then inquires about that order. The example I think I have here is that it may be a nurse that's caring for a septic patient in an ICU, questions the physician as to why maybe a particular antibiotic was DC'd. Advocacy is another component of our role as nurses. And that is to ensure that what's happening for that patient is in the patient's best interest. So being that advocate for our patients. So how do we actually get our point across? What communication tools are out there that we can use? Maybe when we're not being understood. Maybe we have tried something like SBARC, the standardized communication tool that we use at the health system, and for some reason we're just not able to communicate effectively with one another. The crew resource management techniques that have also been identified as being helpful for effective communication includes the 3 W's and the 4-step assertive tool. So I want to walk you through those two tools. First of all, here's just kind of a figure that sort of shows the process in which we do communicate. So at some point or another, we decide we need to take action. So anywhere, anytime within the care we're providing, we need to take action. One of the strategies that can be used is the 3 W's, and that's usually typically what you might use first. And we'll talk a little bit about specifically what those 3 W's are in just a minute. If the 3 W's, if we use that concept, what I see, what I'm concerned about, what I want, and for some reason we're still having difficulty communicating, we may need to go to that 4-step assertive tool. And that's simply really getting the other party's attention, stating our concern, offering a solution, and posing a question. And if that still is not capturing or we're not getting what we need for our patient as we are their advocate, we may need to also continue to move up the chain of command. So let's talk very specifically about some of these different tools. Before I do that, I do want to also talk about something that commonly happens in communication, and that is what's called hinting and hoping. Here's a perfect example of a statement that would be deemed hint and hope. So as you can see from this picture, this house needs a lot of work. It certainly needs a paint job, probably needs way more than that, but more specifically, it needs to be repainted. So if we were going to be talking to our spouse and mention that, the house does need to be repainted, and we were going to use hinting and hoping, we might say something like, I wonder if we have any paintbrushes in the garage. So rather than clearly saying, I see that our house has significant issues because of, paint chips and whatever else. I would like to go forward and have the house painted. Instead, we're hinting and hoping when we're just talking about, I wonder if there's paintbrushes in the garage. So we want to try to avoid hinting and hoping when we use our communication strategies. When we avoid hinting and hoping, our communication should become more accurate. The individual who is listening to what we are trying to say should be able to more clearly understand what it is we want from them. So the first communication strategy is the 3 W's, and this is simply what I see, what I'm concerned about, and what I want. So as we are looking at our patient, we decide that there is some sort of action that needs to take place. It's a simple conversation to say what I see is, and we might state what we're seeing in terms of our assessment findings, whatever else that may be pertinent. Then it's going to the what I'm concerned about is, and talking specifically about what we think may happen. And then finally, what I want, and being very specific about what we want, be it maybe consideration for a medication to be given, be it for the physician to come and assess, whatever that might be, but trying to be as specific as we can related to what we want. So here's an example. Mr. Richards is admitted to the med-surg floor with fatigue and intermittent periods of weakness and shortness of breath. A neurologist is consulted, but ultimately a diagnosis of panic attacks is accepted as the cause of the symptoms. A psychologist is consulted and Mr. Richards is started on anti-anxiety meds. You are the RN that's been working with Mr. Richards. Your assessment reveals intermittent difficulty swallowing and a consistent inability to inhale beyond the 200 mark on the incentive spirometer, despite teaching and frequent reinforcement. You do not believe the patient is having panic attacks and suspect there is something more serious going on. The neurologist stops by to sign off and terminate his care of Mr. Richards. What might you communicate to the physician? So I want you to think just a moment about what you might communicate using the 3 W's: what I see, what I'm concerned about, and what I want. So what it might look like is something like this. You may say to the physician, what I see is Mr. Richards having difficulty swallowing and has not been able to inhale above the 200 mark on the incentive spirometer despite a significant amount of teaching that I've been doing with him. What I'm concerned about is that he has an underlying issue that goes beyond the panic attacks that were diagnosed, and that he could potentially aspirate with his swallowing difficulties. And then what I want is I want a chest x-ray, I want NMTs ordered. Maybe you just want further assessment for any neurological or respiratory issues above and beyond the panic attacks. But try to be specific about what it is that you want. Now, had I gone the hinting and hoping route, I might have said something like, as you're leaving, he almost choked on his breakfast this morning, without really getting specific about what actually happened. So I hope that example gives you an idea of when we say specifically what we see, what we're concerned about, and what we want, we're more likely, or I should say the physician is more likely to understand what it is we're asking from them and what they are to do in response. Now, sometimes we may not get the answers we want, or there still might be some miscommunication after using something like the 3 W's. So the next step is to use that 4-step assertive tool. And first and foremost, it begins with getting the attention of the other members. So if it's a physician, typically we don't call physicians by their first names. So if we are really trying to get a physician's attention, we may say, Bill, and that might get them to understand that there is something that's really coming that is above and beyond the norm. Then stating very clearly what it is that you are concerned about. I'm uncomfortable with you signing off on this patient because he has these difficulty with swallowing and is having some respiratory difficulty. Then offering a solution. I want you to reassess for neurological issues above and beyond panic attacks. Then the final step is to pose a question. And it could be as simple as saying, do you agree? And then having that dialogue. So here's another example. It's 10 p.m. on the med-surg unit, and you are the RN caring for a male patient whose condition is deteriorating. He needs frequent observation due to graduate vital sign deterioration and mental status changes. You contact the on-call physician. You have 5 other patients and are hoping for a transfer order to the ICU. As you begin to explain, the MD rapidly orders continual pulse ox monitoring, supplemental O2 via face masks, labs, chest x-ray, vitals, and neurochecks every 2 hours. What might you communicate to the physician? So my guess would be really what you want out of this is you want the patient to be transferred to the ICU. So maybe it's as simple as saying, again, using the 3 W's, what I see, which is the first part. What I see is a patient that is a patient that's quickly deteriorating as evidenced by mental status changes, vital sign deterioration. What I'm concerned about, the second component, what I'm concerned is that due to my 5 other patients, I'm not going to be able to safely care for this patient because of his significant deterioration and his continual deterioration. What I want is a transfer order to the ICU where he can be monitored appropriately. Now, if I wanted to go the hint and hope route, I may say like, boy, this patient really needs a lot of care, without really, again, getting at what it is that I want. So what I challenge you to do is I challenge you to use the 3 W's for all communication, specifically your paging communication. So an example would be as simple as text or typing in C potassium level of 5.8 for Mr. Jones, concern, rhythm changes, want order for, medication or whatever it might be. Or it could be as, want you to consider reassessment or whatever. But try to use that to see if that does in fact improve the accuracy of communication. One of the things that we heard from the initial data that we collected is that nurses as well as physicians talked about how sometimes it requires multiple pages before we get our point across or we get what we want. Simply by using something such as this may actually help get you where you want sooner than later. The physicians have also been made aware that pages will be in this format, or they are in the process of being aware, so that they too can understand specifically why the changes and how it can improve the accuracy. Now, there are times where you may have to continue to escalate that communication using that 4-step assertive tool, using that chain of command. Just keep in mind that an effective follower really is one that is an advocate for our patients and also inquires about things that may not be completely understood. So we just continue to challenge you to be that effective leader as well as that effective follower. Thank you for your time, and that is it.